Hello everyone, my name is Devanita Shah, Assistant Professor from the Department of Trauma Care Management, Yenepoya School of Allied Health Sciences, Yenepoya deemed to be University. Today, I'm here to present some of the innovative teaching methodologies that we are using in our department to enhance the learning process. The first method is a standardized patient simulation, also known as the SPS. It is a highly effective educational tool commonly used in medical, nursing, and allied health education. In this type of simulation, a live human actor or a trained volunteer known as a standardized patient portrays the role of a patient in a controlled and scripted scenario. The standardized patient is trained to replicate the characteristics, symptoms, behaviors, and emotional responses of a patient based on the specific needs of the scenario. Standardized patient simulation is particularly valuable in scenarios where the focus is on the interaction between the healthcare provider and the patient. Learners practice obtaining a thorough and accurate medical history and conduct a physical examination where the standardized patients provide feedback on the appropriateness of the techniques used and learners' communication. Learners also practice delivering difficult news and taking informed consent to perform certain medical procedures. They also learn dealing a challenging patient interaction, such as dealing with angry, anxious, or non-compliant patients. The second method we use is a human patient simulator. A human patient simulator, also known as the HPS, is an advanced, full-body, and anatomically correct mannequin designed to mimic human physiology and anatomy. Controlled by an operator or facilitator, the HPS is a very sophisticated piece of technology used primarily in medical and healthcare education. It provides a realistic and immersive environment where learners can practice clinical skills, perform medical procedures, and make critical decisions without the risk of harming the real patients. There are different levels of fidelity for HPS, including low, mid, and high. Low fidelity simulators, which are also known as task trainers, are less realistic but can help learners build knowledge and focus on skills without the stress. They can be used for repetitive practice of skills like wound care or catheter placement. The mid fidelity simulators are more realistic and can help learners build competence. For example, they might include full body mannequins that can initiate breathing and heart sounds. Whereas the high fidelity simulators are the most realistic and recreate real life scenarios. They can include full body computerized mannequins that can talk, breathe, blink, and respond to interventions. The third method used is a hybrid simulation. Hybrid simulation merges two key components. The first one is standardized patient simulation, which we have already discussed. The second one is a task trainer. A task trainer is a physical model trainer which replicates a specific body part or organ, designed for practicing technical skills such as intravenous insertion, intraosseous insertion, suturing, or other advanced medical procedures. The fourth method is a task trainer. So the task trainer, as said, is a specialized type of simulation equipment which is designed to replicate any specific body part or anatomical regions based on which scenario we are using. It is used to help learners practice and develop proficiency in particular clinical skills and procedures. Task trainers are used across various medical fields and disciplines and can be applied to train learners in numerous procedures, including IV and IO insertion, intubation using the airway trainers, obstetric delivery using the OB task trainers, and central line placement using the central line trainers. Task trainers are a cornerstone of simulation-based medical education, providing learners with the hands-on experience needed to develop critical skills. The last method I am going to discuss is moulage. Moulage is the art and practice of applying makeup, prosthetics, and simulated injuries, other special effects to create realistic representations of medical conditions, injuries, or trauma on high-fidelity simulators or standardized patients. Moulage is a crucial element in simulation-based medical training as it significantly enhances the visual and emotional realism of the scenarios. Elements like latex, silicone, simulated body fluids such as blood, mucus, sweat, along with adhesives to secure prosthetics are used to give the best visual effect of the injury to be dealt with. Now, by providing learners with such opportunities to engage in realistic patient interactions and case scenarios, we can develop their clinical competence, communication skills, as well as confidence. As healthcare continues to evolve, the role of standardized patient simulation in training and assessment will remain critical in preparing healthcare professionals to deliver high quality patient centered care. With this, I would like to conclude. Hope this was helpful. Thank you so much for listening.